Welcome to an instructional video on the proper use of the VeinStay. The VeinStay is a device that will help the clinician visualize, accentuate, and stabilize the vein during venipuncture techniques. The VeinStay is comprised of a handle with 3 prongs on it. In the handle is a hole or circle where the clinician will place their thumb. At the end of the handle is a lip turning downward. The clinician would place their index finger or middle finger under the lip, applying an upward force as they use the thumb as a fulcrum, and then the tines are pressed firmly against the skin, straddling the vein. This will allow the vein to be captured between the tines. The tines used in this video have a white marking on them, which will act as a target for the clinician in placement of the needle or catheter into the vein. In our first case, we have a 63-year-old male who will have a venipuncture performed in the antecubital fossa. Both the basilic and the cephalic veins will be evaluated, with the cephalic vein being chosen for the venipuncture. Standard phlebotomy techniques are used, that being a tourniquet as well as aseptic and sterile technique. The area is cleansed with a topical antiseptic, dried with sterile gauze. We will be using a 16-gauge catheter in the venipuncture process. The catheter is removed from its outer packaging, keeping it in its sterile inner packaging. The VeinStay is removed from its sterile packaging, and the clinician should be careful not to contaminate the tines or the prongs. The VeinStay is then placed, in our situation here, over the basilic vein in the antecubital fossa. The white markings again indicate the area where the clinician would want to target for entry into the vein. We are now using it in the antecubital fossa again, only this time with the cephalic vein. The white marks indicating the target area where we would like the clinician to enter, as this is the area of greatest stability for the vein. Once we've entered the vein VeinStay is set aside, and we can see that we have a flashback of blood into the catheter hub, indicating successful venipuncture.